வந்து எல்லா ஹாஸ்பிட்டல்லையும் குழந்தை பிறந்தவொடனே ஆண் குழந்தையா பெண் குழந்தையா சொல்லுவாங்க. அவங்க இல்லை சொல்ல முடியாது, உங்ககிட்ட சொல்ல முடியாது, உங்கள் ஹஸ்பண்ட் கிட்ட நாங்கள் சொல்லுவோம் அப்படின்னு கூப்பிட்டு போய் எடுத்துகிட்டு போயிட்டாங்க. நான் ரூமில் இருந்தேன்.
அவங்க என்ன பண்ணாங்க, குழந்தை வந்து பொண்ணா பையனானே எங்களால் கண்டுபிடிக்க முடியல, ஏன்னா ரெண்டு உறுப்புமே இருக்கு குழந்தைக்கு.
This is about a 24-year-old lady who had undergone antenatal ultrasound at 9 months of amenorrhea. The previous antenatal scans had been done elsewhere and were reported as normal by the fetal biometry with no major anomaly. Now I am giving the fetal biometry and then the two pictures of fetal perineal ultrasound. What is the finding in the first picture? What is the sign in the second picture? Now think about your differential diagnosis and the final diagnosis. If you want more time, please pause the video and go through the image again. Within few seconds, I'll talk about the findings, the sign and the differential diagnosis and the final diagnosis. Are you ready? Let's go. The fetal biometry almost corresponds to the LMP. The first perineal image shows a bifid scrotum, but the vulva-labial complex is a closer mimicker for that. The second picture gives the typical tulip sign, which indicates the angulation of the penile shaft, which is seen within the bifid scrotal folds. Again, an enlarged clitoris in ambiguous genitalia also mimics it in the late second trimester or in the early third trimester. With such pictures, the differential diagnosis is either severe hypospadias or ambiguous genitalia. Now we'll go to the tulip flower. We all know that rose is the most popular Valentine's Day flower, but only few people know that tulip is the second most popular flower in the Valentine's celebration. This flower is like that of a rose and it is longer lasting than the rose. I am giving the picture of the tulip flower here and you can compare that flower with our antenatal and postnatal pictures. So the final diagnosis is hypospadias. To understand better, we will discuss about the embryology here now. At 9 to 11 weeks, two genital tubercles are seen in all the fetuses, one in the right side and the other in the left side. What happens here from 12 to 14 weeks? In a male fetus, there is fusion of the genital tubercles which form the scrotum with the phallus formation which is called as penis. In female fetus, the unfused genital tubercles become the vulva with the phallus formation called as labia clitoris complex. Testes in a male fetus are seen above the inguinal ring from 12 to 14 weeks. Then there is lateral to medial inguinal descent of the testes for 3 to 4 months and that occurs from 14 to 28 weeks. From 29 to 39 weeks, the testicular descent is complete in almost 99.999%. Actually speaking, 98% of the fetuses show the testes reaching the scrotum by 33 weeks. Another information is that more than 50% of fetuses show the testes reaching the scrotum before 30 weeks. Now we go for short practical discussion about hypospadias. Normally the external urethra should open to the tip of the penis during micturition, most of the times with some penile erection. If the external urethra opens in the inferior aspect of the penis, it is called as hypospadias. The abnormal opening can be in the penile glans or penile shaft or in the penile base, and rarely it might open at the mid-scrotal raphe or in the perineum. Tulip sign is the sign due to the angulation of the penile shaft which is seen within the bifid scrotal folds. This might be negative in milder forms without any bifid scrotum. Nowadays, even B-mode perineal scan might look normal, but with color Doppler, it might be detected. So color Doppler is important nowadays because normally there is ventral jet flow towards the probe. But if the urethral jet is seen in the opposite direction and is almost coloring just near the fetus, that's highly suspicious of hypospadias without any bifid scrotum. We have discussed in detail about the antenatal diagnosis of hypospadias by the tulip sign with the penile shaft sitting within the bifid scrotum. Please give your comments and opinions. Even if you have got your own queries, they are very much welcome. If you are interested in the other quizzes, you can click the blue colored R button to see rest of the quiz list. You can click and go through the quizzes if you are interested. Thank you very much for your patient hearing. Bye bye and be healthy.